Well, it's my pleasure to come and talk to you guys. I've been out here in Easley now for about 2 years. I have a private practice that is on just the Easley side of Greenville, and I can come out here 1 or 2 days a week to see people, and I love it. I love this hospital. As she mentioned, I'm a plastic and reconstructive surgeon, so I do pretty much everything when it comes to plastic and reconstructive surgery. About me personally, I'm not this doctor. I don't know if you guys ever watch this on TV. I hate this show. I hate when people come into my office and get a surgery and say, you make me look like those people on Botched. Right. No, not me. So what I am is I originally was actually an engineer, and I did engineering for a little while. I missed just the human interaction aspect, and I went back to school and did medical school from the beginning. I went back and I had to take freshman biology and went through all of that, did my training. I did a special kind of training program in Missouri where I just did plastic and reconstructive surgery. So some people be a general surgeon for 5 years, and then they do another 2 years for plastic surgery. My training was just 100% 6 years of plastic surgery, which also let me train in hand surgery, similar to an orthopedic hand surgeon. It's basically the same exact thing, to have that credential. When I give talks like this, I like to talk a little bit about things that in plastic surgery affect people more often, questions that I get frequently. And one of the things that I always get questions about is, can you look at this? It's similar to a dermatologist. Does this look right? Skin lesions. And it's an important thing. So I have a couple little slides about that initially. So skin lesions. Number one thing is talking about risk factors. So biggest risk factors for getting bad skin lesions. Number one thing is genetics. It's just the card that you're dealt. If you have lighter skin, you're more susceptible to getting sun-based skin lesions that can turn into skin cancer. You can't really change that. But what you can change is how you're exposed to the sun. So the most dangerous sun exposure is high levels of exposure intermittently. So you go the whole winter, and then the first time in the beginning of the summer, you get toasted so that you actually get blisters. That's far worse than going every day and just getting a little bit of sun. Certain things make your sun exposure worse. So if you get a lot of sun exposure and you're cool, it's not as bad as if you get a lot of sun exposure and you're hot. If you're in any kind of noxious environment, so if you got a lot of sun exposure in the past and you were spraying pesticides, so something else that isn't good for your skin at the same time, those two things will work together to increase your risk of having a skin cancer. So the things that you can try to control are, well, you try to stay out of the sun, but you got to go into the sun sometimes. So I get asked about sunscreen. What's the best kind of sunscreen to wear? Do I need to get like SPF 100? So the first thing is explaining what SPF means. It basically is the fraction of the sun that it lets through to your skin. So to give you an example, SPF 30 means that if you have skin that you burn in 1 minute, you put on SPF 30, you're going to have that same burn in 30 minutes. If you burn in 10 minutes, that's going to get you out to 300 minutes. So the SPFs that get up to like 100, that kind of thing, they're not really worth it, because no one burns in 1 minute, or very few people burn in 1 minute. And so if you put on SPF 100, the SPF protects you for, okay, you're not going to burn for 3 hours, but you are, because none of the sunblock lasts more than 2 hours or so. And that's if you're in just a normal environment, not swimming at the beach or anything else. So having a reasonable SPF and reapplying the sunblock frequently, those are the two keys. So you don't have to have this crazy high SPF. You do need to have something that you reapply often. And you want to have something that says broad spectrum coverage. Most of the ones, because there's two kinds of sun rays that get you. It's UVA and UVB. Most of the sunblocks out now say broad spectrum. And then just consistency, so applying it every day, applying it more than one time a day. Those are the most important things. So I always mention clothing because people figure I'm wearing a shirt, I'm protected. A normal white cotton shirt, when it's not wet, has an SPF of about 8 to 10. So a lot is getting through it. You can actually buy shirts for working outside that have a sun protection factor. If the shirt gets wet, it's like a 2 or a 3. So you picture, like, you know, little kids and grandkids running around on the beach with wet t-shirts. It's like they're not wearing sunblock. So when you have a skin lesion, we go by something called, how do you know if it's something that we need to be worried about? And so we do the A, B, C, D, E's. These are the factors that when I'm looking at something, I'm saying, is this unusual? Is this something that I need to take off and send to another doctor to look at under a microscope? So the first thing is asymmetry. Lesions that aren't symmetrical. So something that's nice, round, well circumscribed, it's very unlikely to be bad. But something that's asymmetrical, that puts up a little flag. Next thing is border. So this goes a little bit with the asymmetry. If the border is irregular, it's jiggy-jaggy, that's another thing that does not bode well. Color. So by this, it means if it has more than one color. So you look at it and it's got little speckles of different color here, there, and everywhere. That's also a warning sign that this could be something that's dangerous. Diameter. So anything that's bigger than basically the head of a pencil, so the eraser on a pencil. Once they get past that, that's something that warrants further evaluation. And the last thing, and this is the most important thing, and it's why you need to go in and see a dermatologist, see a me, is it changing? You know, if you've had a little funny irregular thing on your leg since you were 4 years old and it hasn't changed, it's fine. It's not going to be anything. But if you have something that looked like a little freckle 6 months ago, and now it looks like the same little freckle, but it's the size of a quarter, that's something to be concerned about. Digital photography has made this so much easier. Because basically when you come into most dermatology clinics, you come into my clinic, we just take a bunch of snapshots. And if there's anything looking between 2 sets of snapshots that looks like it's changed, then that's got to go. We biopsy it. Another thing that I get asked about all the time is scar management. So people think that as a plastic surgeon, I've got like some magic tricks that I can do surgery and you're not going to have any scars. Anytime we do surgery on someone, at least not inside the womb, there's a scar. So we have tricks to try to make those scars as favorable as possible. So if you have a loved one who goes into the emergency room and has the cut in their head, and you want it to look the best that it can, first thing is, again, sun exposure. Sun exposure will make a scar pigment. It'll be darker as a result of sun exposure. So you got to keep it out of the sun as long as it looks pink. Basically, the sun almost tattoos that pink coloration in place. Can take as long as 6 months to a year for that pinkness to go away. So it requires a lot of diligence. Topical stuff. People love to ask me, well, can I use this cream on my scar? Is it going to make it better? By and large, they all work. And they work not really because of what's in them. It's not the vitamin E, it's not the cocoa butter. It's you actually applying them. It's the massage of applying the cream to a scar is what softens it and breaks it up. It makes for a better scar. The last thing that we do is we do something called silicone sheeting. You can buy it over the counter. There's a brand called ScarAway that's way too expensive, but that's what it is. You can buy it on Amazon for much cheaper. And you put the silicone sheeting on your skin and keep it there as long as the scar is raised. And it works. It's what we put on patients who have had burns. It's very, very effective. So these, any questions about anything I mentioned so far? These are my 2 little kids. What I was going to go into now, and I warned people beforehand, this is what I do. So there are going to be some pictures of surgeries of people before and during surgery and how we fix them up. So anybody who's a little squeamish, you can turn aside because some of them are pretty graphic pictures. Are you guys okay?
Yeah.
Okay. All right. So this first gentleman was a very unfortunate gentleman. He is paraplegic. So he sits in a chair all day. And what he has is he has a pressure sore. Pressure sore is right there. It looks like a little hole there. It's right on kind of his sits bone, but there's an ulcer that goes as big as this entire area, and it won't heal. He needs to be able to sit. He needs to be able. This is a great guy. This guy actually we treated here. He needs to be able to sit to be able to work, but as long as he has this hole there, he can't sit. I mean, he has to be in bed all the time on his back. So as a plastic surgeon, what I can do to fix this is it's a very big hole to fill in. There's not like you can just bring those edges together and sew it closed. You've got to bring something else in there to close it. And so this is called a VY hamstring flap. This is the back of his leg. And what I do is I take the skin and all the muscles from the back of his leg and I move them up there to fill that gap. And so that's what he looks like afterwards. So you can see all of that stuff's been moved up and then actually under into that hole. And he's sewn up. He has to recover in bed for a little while afterwards, but he's fixed. This is kind of a bread and butter reconstructive surgery that a plastic surgeon does. Next case. So this one's another one that's very interesting. So this is a 45-year-old gentleman who had a very, very bad belly infection. He perforated his colon. And when you have a really bad, like any other part of the body, if you have a lot of infection in the inside, you can't just close everything up over the infection. It's just going to fester in there. So what they had to do with him is they had to let him heal almost from the inside out with his belly open over months, exposed. And then they just put a skin graft over all that stuff, for lack of a better word, over all the chitlins. They just put a skin graft, which is where they take a shave of skin from somewhere else, lay it on there, and that's how they get it covered to close it. But it's not a good way to live because he looks originally like this. This is everything that was inside his belly, and there's nothing holding it in because all of those muscles on the outside retracted. So how do we fix this? Well, what we do is we go in and there's lots of layers of muscles on the outside. In fact, there's 2 layers that you can separate and you can slide them. And so you go in on those little sides, you lift up the inner layer of those muscles on one side and you slide it, and then you can actually unfold it a little bit and flip it over to get more length. And you do the same thing on the other side. And what you end up with is a closed belly. So it's the same guy for that surgery. That's a fairly big surgery. Another surgery that we do. So this is someone who had a heart bypass graft. So they opened up his chest, he had the sternotomy incision, and it got infected, which happens. A lot of times the blood vessels that they're using to revascularize the heart, to bring to the heart, are also the blood vessels that used to go to your sternum. So now they don't have any blood vessels, not real happy. They get an infection really easy. And this is a problem because underneath that stuff is, underneath that cartilage is really important things like your heart and your lungs that you don't want not covered up. So what we do to cover these up, we get it all cleaned up, and then I take, similar to kind of the other surgery that I did, I take both of his pectoralis muscles and I lift them up and I slide them over into the middle and sew it all closed. And that's a very frequent surgery that we do for people who have problems with their heart surgery healing up. I think this is the last one. So this is a young gentleman, motorcycle accident. So he got road rash, scraped the back of his hand off. So these are all of what's left of his tendons, and he's got no skin over the back of his hand. So you got to figure out a way, even before you can get, if you want to get any of those tendons working again, you've got to cover that up with something. And there's nothing you can just pull from the sides that is going to cover that up. So what do? We do a free flap. So this is a surgery where I pick another area of the body. This is from the back. And I mark out how much skin I need. And I find the blood vessel that goes directly to this skin. And they're small, they're 2-3 millimeters. I find it using an ultrasound, and then I remove it completely from that area, and I find another set of blood vessels, and I sew it into this set of blood vessels. And now it covers up the back of that hand. So you can move something from a chest to a leg, from a butt to a hand, from pretty much anywhere that you know has a reliable blood vessel where you're taking it and a reliable blood vessel where you're putting it. And these are technically the most complicated surgeries that I do. This has to be done under a microscope. It takes about 12 hours. The suture that we use to sew those little blood vessels closed is thinner than a hair, like a human hair. It's very, very meticulous stuff. So that's just a little blurb about me. This is my son. This is his stitches because he ran away from his mom and dove into our fireplace. My wife called me at work and was like, "Are you ready to do your first set of stitches in your son?" I said, "No, thank you." But we did it anyway. So what I tell people is if you ever have any questions, especially what probably comes up the most is if yourself, your family, your friends get injured. I'm always on call. And you go into the emergency room and you're like, I don't know if I want this person sewing up my cut. Or they just say they're not going to sew it up. Just write my number down. I have my cards. You can always call me. Like millions of people, mostly moms groups, have my card. And you can call me. If I can get there or get you into my office, I'm happy to take care of it. So.